So now kind of looking back, and I know you're still, in some ways, in the thick of it, but what advice would you give other patients who are, say, newly diagnosed with metastatic uveal melanoma, or is there anything kind of you wish you knew? Anything you could share with folks?
Well, I do have a soapbox I get on about this, and it's that I believe everybody should pursue a doctor, a physician group of people who know how to treat this. I call it trying to get to a center of excellence. Get in front of the doctors who know what they're doing, and this is their passion. This is what they do. And so my biggest advice would be to do that. I cannot tell you the number of people I interact with who are nervous about getting a second opinion, nervous about hurting a doctor's feelings, and I just strongly suggest getting in front of a doctor who knows because there's so many treatment options out there that you have to be careful. For one, you want to get the right treatment at the right time. And two, a lot of what is available to us are clinical trials, and you don't want to do a treatment that could prevent you from being on a trial later. And I feel like the only people who really know that are the ones who are immersed in the treatment of this very rare cancer. I run a foundation that helps people travel for treatment. We pay for it entirely, and all you have to have is a diagnosis of ocular melanoma. And the reason that we started this foundation, which is called the Eye on Grace Foundation, is we want people to do what I'm talking about. We don't want the burden of travel expenses to prevent you from getting the best care possible and getting in front of people at a center of excellence. So that's probably my biggest advice is I have had full confidence in my team of doctors, and I've been successfully treated. I have the worst genetic markers. I'm HLA positive, PRAME positive, GNA 11, BAP1. I mean, all the things that should have me not talking to you today. And yet here I sit successful in the treatments that have been provided for me. And I'm just really grateful. I think the only other thing is this can be a really lonely cancer, really lonely. I mean, cancer is lonely in general, but this is really lonely because sometimes you don't know anybody else who has this cancer. And so I'm a big advocate for support groups, for getting educated. I say be careful about some of the information that you're given and to seek wise counsel on it, which again, I think can only come when you are with doctors who this is all they treat at a center of excellence.